High blood pressure, also known as hypertension, is something you've probably heard about a lot. It's one of those terms that pops up in doctors' offices, on health posters, and in news reports, but what actually causes it? Why do so many people have it? And what's really going on inside our bodies? Let's start with what blood pressure actually means. Picture your blood vessels as an incredibly extensive, flexible highway system. Every time your heart beats, it pumps blood into these vessels, creating pressure on the walls, similar to water flowing through a garden hose. Too much pressure over time, and those hoses can get damaged, making blood pressure a silent but dangerous risk. So what pushes that pressure higher than it should be? One of the biggest culprits is diet, specifically eating too much salt. When you eat foods high in sodium like processed snacks, canned soups, or restaurant meals, your body holds onto extra water to dilute the salt. That extra fluid increases the volume of blood, putting more pressure on your vessel walls. Over time, this steady pressure can cause lasting damage to the arteries, hardening them and making the heart work even harder. It's no surprise that populations with high sodium intake have higher rates of hypertension. But it's not just salt. Weight plays an enormous role too. Carrying extra pounds means there's more tissue for your heart to supply with oxygen and nutrients, which demands more blood flow. As the volume of blood circulating through your body increases, so does the pressure on your vessel walls. Even a modest amount of weight gain can have a noticeable effect on your blood pressure, and the risk ramps up as body mass climbs. Lack of physical activity is another contributor. Regular exercise helps keep your arteries flexible and your heart strong. But when you're sedentary, your heart has to work harder to pump blood, and your vessels gradually become stiffer. Over time, this rigidity causes blood pressure to creep upward. Then there's stress, another modern villain. When you're stressed, your body releases hormones like adrenaline and cortisol that raise your heart rate and constrict your blood vessels. This is useful in short bursts, like if you're running from danger. But chronic stress keeps your blood pressure elevated far longer than it should be. The long-term effect is kind of like driving a car with the engine revved up all the time. Everything wears out faster. Smoking and heavy alcohol use make things even worse. Nicotine causes blood vessels to narrow, upping the pressure every time you smoke. And alcohol, especially in larger amounts, can both directly raise blood pressure and indirectly harm your health by influencing diet and weight. Some causes aren't as immediately obvious. Genetics play a significant role. If close relatives think parents or siblings have hypertension, your risk goes up, even if your lifestyle is relatively healthy. Certain inherited genes can affect the way your body manages sodium, handles stress, or repairs vessel walls. Age also matters. As we get older, our arteries naturally become less elastic. Imagine a brand new rubber band versus one that's been in the drawer for 10 years, stiffer and less stretchy. This loss of flexibility means the same volume of blood puts more pressure on the vessel walls. There's also the health of your kidneys, which control the body's balance of salt and water. If your kidneys aren't working as they should be because of disease or damage, sodium and fluid can build up, raising your blood pressure. Some other chronic conditions, like diabetes and certain hormonal disorders, can also contribute to hypertension. You might be surprised to know that even sleep can affect your blood pressure. Conditions like sleep apnea, where breathing repeatedly stops and starts at night, force your body into cycles of oxygen deprivation and stress, which keeps your blood pressure chronically high. Finally, some medications can raise your blood pressure as a side effect. Common culprits include certain painkillers, cold remedies, and birth control pills. It's important to know what's in your medicine cabinet, especially if you're managing your numbers. So when it comes to high blood pressure, it's rarely just one thing. For most people, it's a combination of lifestyle choices, genetics, and changes in the body over time. The good news, unlike some health issues, many of the causes of hypertension are within our control. Cutting down on salt, staying active, avoiding tobacco, and managing weight can make a real difference. High blood pressure may be common, but the path it takes inside each person is unique. By understanding what's pushing that pressure higher, we're all better equipped to keep our blood vessels and our hearts healthier for longer.